What I'm talking about today is a puppy office visit, and what we do is we recommend puppies come in starting at 6 weeks of age or as soon as they quit nursing from their mom. As long as they're nursing from their mom, they're getting maternal antibodies from her, paternal antibodies, and that way they're okay against this parvo and some of your viruses. But it's time they quit nursing, they can get exposed to those viruses. So it's really important they come in at that 6 week of age mark to get their first set of vaccines. And then they need it boosted every 3 weeks. So we recommend 6 weeks, 9 weeks, 12 weeks, and then 15 weeks to finish up. And then they're good for a whole year before they need to get them boosted again. So when they come in to see us, what we're doing is we're doing a good physical exam. We also check a fecal on them to make sure they don't have any intestinal parasites, because it's not uncommon at all for puppies to have worms. So you're going to make sure, see what they do have, if they have anything. They get a good general dewormer regardless, and if something is positive, then we'll treat for that specific parasite. We also see if they have fleas, anything like that. Depending upon the age, and we'll talk about flea products in a little more detail, figure out what may be the best flea product for your puppy. Depending upon if it's an indoor outdoor dog, the kind of dog it is, and all that makes a big difference in selecting what product may be the best. This is Ellie Mae. Ellie Mae is a 6-week-old little puppy, and she's here to go over what all we do with our puppy office visits. What we like to do with them first, we're going to check and see how many pounds they are. 8 pounds. What we like to do when they first come in is find out how old they are, what all they've been through, if they've had any vaccines from the breeder, where all they came from. So we're going to give her first vaccines today. So we like to check their temperature and get a good fecal on them. So we're going to do that initially. And we'll try to find out is what type of food that they're feeding these puppies. Diet is one of the most important things to do on them. So the main thing with puppies is we want to make sure they come in every 3 weeks, starting at the age of 6 weeks, 9 weeks, 12 weeks, and 15 weeks. We do a general dewormer for them usually, unless we see something on parasites, and then we'll do something in addition to the normal. Also try to get you started on heartworm and flea control. And then we get the doctor to come in. They're going to do a good physical exam and check up on her to make sure there's nothing else happening with her.
So we're talking about puppy office visits. So it's the first time that we see this particular dog in our practice, and usually this is the first time that the clients have brought their new baby to see us. Our biggest thing here is to just get a good general checkup of all the body systems, just on physical exam. And so basically it's the cornerstone of of the overall general health of the puppy and starting the puppy out right and healthy. So during the puppy office visit, we're just giving an overall general checkup, checking the eyes, checking the teeth, looking at the soft palate, making sure, mainly looking for congenital things that could be going on. Basically congenital things are things the puppy was born with. And basically test motor control, just a short little neurologic exam, making sure everything, all the nerves are firing, listen to their heart and lungs. And basically just an overall run my hands up and down and just feel it, make sure everything's in good order. Then we kind of go over the test that we run, which is a fecal exam looking for intestinal parasites, and then discuss with the client again the cornerstones of good health, the nutrition, the vaccination protocol, and puppy training too. We talk a little bit about that. So just getting the puppy started to a healthy life, hopefully.